Hey everybody, I'm Dr. Rob DiMartino, and I wanted to make this video today because in addition to having coached doctors for the last 6 odd years and implementing functional medicine ideologies into their office, for the last 13 odd years, I've dealt with some of the most complicated autoimmune diseases known in my office. It's basically what my office has become, is dealing exclusively with just those types of problems. And one of the most frustrating things when, I go to a lot of seminars, I talk to a tremendous amount of doctors who reach out to me for either help with their patients or if they're interested in implementing functional medicine into their clinics. And in all these doctors I talk to, the one thing that's overriding in all of them is frustration. Whether it's frustration trying to put these protocols into place, frustrations in getting truckloads of patients who are coming to them with these kind of problems. And if you've gone through any kind of basic functional medicine type of protocols, basically the two things that we have at our disposal to try to get these patients better is either dietary changes or supplements. Now, one of the big problems with that is both of those things are entirely dependent upon the patient actually doing them. So, are they going to stick to the diet 100%? Your results are tied into will they be compliant, which a lot of the times is difficult for most people. But the flip side is a lot of these doctors are super frustrated because these problems are really difficult to solve and they're not getting the results that they want to get with them, which is the kind of worst kind of frustration to get in practice. It leads to what I call bitter burnout, where just doctors get exhausted because they're just not getting the results that they got into this to ultimately do. And one of the things I always tell those doctors, even the guys and gals who are out there doing the crazy muscle testing stuff, which I do too, and you do all the different muscle testing and go through everything, that's even more exhausting because you're trying to take them apart to the nth degree and still getting a limit on the amount of results that we can get. Even though obviously these patients do well, it's not that resolution of the problem that we always went and wanted. So think of it this way. If we all basically agree throughout all of medical, including the internet, that we agree that the greatest thing you could do for an autoimmune disease patient is to make them fast. Make them not eat any food for a length of period of time. If that complete restriction of the food is one of the greatest things that we could see to change somebody's immune system patterns, then how do we sit there on the other side and believe and teach that the only way you can try to resolve these things is through diets and supplements? How are you going to nutrition them out of a problem that is not a nutritional problem? So essentially, at the end of the day, the moral of the story of this video is autoimmune disease is not a biochemical disorder. It's not what it is. It's never been what it is. And just like the medical world has big pharma, and we kind of rail against them all the time, the natural medicine world has big supplement, where they're just basically telling us, give droves and droves of supplements. And a lot of doctors, including myself, I used to get crazy when my office manager would walk in because if she was the day to order supplements, I knew what that bill was going to be, and I was basically carrying a GNC, and I didn't get into this to do something like that. So to see that kind of frustration occur when it's really not a biochemical disorder at all, it makes total sense why you find doctors who have such severe burnout. So we've been really lucky. We've implemented a lot of different technological practices into our clinic that are incredibly effective, incredibly easy to use, and also incredibly cost effective, where it doesn't break the bank for the doctor to actually put those things in. And to take something like an autoimmune disease like Hashimotos thyroiditis, okay? Hashimotos is low thyroid caused by an autoimmune disorder. And we have lots of videos on that if you want to go out and watch what that actually means. But when we have Hashimotos, using the tech and some very minor dietary and very, very little supplementation, if at all, we've been able to get an 80% complete reversal rate of Hashimotos. It got me a lot of attention of how I was able to do that. And the way I was able to do it was I had technology in my office that was allowing me to be able to get some of those results that I couldn't just get with dietary stuff alone. Now, again, it's not to say you have them eat whatever they want and they can eat terribly, but just that eating that way created a limit of how much healing I could get done for them. It's just not something I could ever achieve if we didn't have the understanding and if we didn't have the ideologies that we were putting in place in practice every single day. Once you can get the ideology of what you're trying to accomplish, functional medicine is kind of opposing to a lot of doctors in natural healthcare, and I get that, because essentially it's like acting like medical doctors with vitamins. There's no underlying philosophy of what we're trying to do. We're just ordering a truckload of blood work and giving them a vitamin for each thing that's wrong. And we're saying that's looking for cause, but at the end of the day, what's causing those numbers to be off is really never dealt with. It's just something we're trying to chemically balance without looking at the overall picture. And when you can get that overall picture in place, these kind of problems can start to get levels of healing and resolution that before we've all been told is really not possible. And again, I put this in place not with the ideology of teaching it, but with the ideology of doing it for my patients, and like I said in another video and earlier, to do it for specific family members who were dealing with their own health challenges. So that was why I got into all of doing it, but I've been happy to share those ideologies with other doctors, because nothing gets me more excited when I can watch a doctor get the same result for a Hashimoto's patient in a different state just using the protocols that we're using, because ultimately if those become the results, the medical world is going to have a hard time not looking at us, and that's going to become the standard of care for ultimately what we're doing in the treatment of autoimmune disease. So that being said, I hope you enjoyed this video. If you think there's anybody else out there that you know would think this is kind of cool stuff, please feel free to share it with them. As always, I thank you for being in the trenches with us trying to help these patients. Hope to see you soon.